I looked at Dr. LaFerriere, and his credentials spoke for themselves. First, he specializes in facial plastic surgery, and he's nationally renowned for lectures and mentoring other physicians.
I felt very comfortable with him, and he treats everyone like they're the most special person in the world, like he's been waiting all of his life for you to come into his office.
I'm Dr. Keith LaFerriere, and I've been practicing facial plastic surgery in Southwest Missouri and Northwest Arkansas for over 33 years. I'm the oldest of 5 children. My dad had never been able to go to college, and so he wanted to make certain that all of us got our education in various areas, and I was elected to be the doctor. And quite frankly, I thank him tremendously for that. Over the years, I've done really the full gamut of facial plastic surgery. The procedures that I mostly specialize in are aging face, facelifts and eyelids, skin resurfacing, and rhinoplasty. Of course, I love to operate, and I love being in the operating room. You're there with other professionals, such as your scrub techs and your anesthesiologist, and we're all there for one reason, and that's to get the best result possible. At the end of surgery, when we're closing, we play Lynyrd Skynyrd. We do. Sweet Home Alabama, and the whole bit. When you see people who have not been particularly pleased about some aspect of their appearance, when they come back in and they're happy, and you actually see them as a transformed person, the way they carry themselves, all are very rewarding because we made that happen. One of the things that keeps me interested in facial plastic surgery is trying new technologies. That's one of the beauties of having the experiences that I've had going literally all over the world, meeting colleagues and learning from them, and of course teaching them as well. And that interaction, I think, often does lead to a lot of technological innovations. I've also been pretty active in the medical community as well. For the past 20 years, we participated in the domestic violence program through the American Academy of Facial Plastic and Reconstructive Surgery, providing our services to help those victims of domestic violence and abuse. Southwest Missouri and Northwest Arkansas are really nice places to live because there are many recreational opportunities, great place to raise a family, and the people are really neat. And that's the basis of my practice, is the people. I think patients are very appreciative in this area, and that makes it a lot of fun to practice. Outside of medicine, I actually have a lot of interests. My wife of 45 years and I have been blessed to be able to travel a fair amount. I've always enjoyed playing golf, and I'd like to be better at it, but I'm trying. I spend a lot of time, outdoors with my wife. We walk, etc. I exercise 3 times a week and enjoy that very much. And in the fall, of course, I'm a huge Michigan fan, so football on Saturdays is always a treat, and actually we get up there to a game once a year in Ann Arbor, and that's always fun. A very common statement that patients make is, I want to look as good as I feel. In large part, that's what we can accomplish. We can make people look as good as they feel, because when they look in the mirror, then they see something that they like. If it doesn't look natural, it doesn't look good.